concierge health advisor. Whoa! Continuing on the medical myth series. You clicked on it. Today is about oral health. Oral health. Let's do this. We've all heard about the brush after every meal, brush twice a day, brush once a day, use mouthwash, use dental floss, use those stick things, use those aqua toothpicks. I've used them. Really? Mouthwash, yes, we get that. Tongue cleaners, we've heard that. What else? Oral health, chewing gum, drinking water. Right, you get it. I've pretty much covered 90%. I think so. Oh, never mind the micro. How about the macro? Visit your dentist every 6 months. Get it clean after every visit. Lovely. And then your teeth fall out. yeah. You get it, right? You get it. And your child is brushing their teeth. Cavity 1, cavity 2, cavity 7, cavity 9. What's going on there? Oh, brushing, flossing. The adolescent, orthodontia. You get it. The braces. And then when you're age 65, 75, I don't know, your teeth are fizzing by the side of your bed. That child, adolescent and elderly outcome, all that is, my dear listener, of your calcium deficiency. Oh, no, it can't be because I take calcium. I have plenty of dairy food. I supplement. There's calcium in some vegetables. There's calcium there's calcium in my dairy-free stuff. Well, all that means is that we're not absorbing. 98% of us, 98% of our pets, 98% of all vertebrates for that matter, can't absorb what they are taking in, particularly with minerals. We need minerals to make the vitamins work, to make those amino acids work, and to make the essential fatty acids work. Those 4 categories of micronutrients that keep us slim, that keep us away from chronic disease, chronic illness, and keep us away from autoimmune disease, keep us away from genetic disease. They don't exist. Genetic diseases are code unknowingly for nutrient deficiencies. And if it runs in your family, well, that's the only thing that's Freudian slip, that's the only thing that's genetic. If it runs in your family, is your ability to absorb those particular micronutrients that lead to obesity, metabolic syndrome, the whole, yes, obesity is part of metabolic syndrome, blood pressure, diabetes, blood pressure. Right? It's not. No, it's not your diet. It's not your diet choice. It's not. It doesn't run in the family. It's not toxins. It's not your lifestyle. It's not. You don't exercise enough. Oh, how did that look? Yeah. So, if you're okay, as I said, 98% of us are gluten insensitive, which means wheat, barley, rye, and oats. If you think that you're eating gluten-free and you're eating oats to make up for the no gluten, you're stuffed. You're stuffed. Oats has gluten in it. It's not called gluten. It's called gliadin, and it's called. There's another type of gluten in there. Adenine. They're all those villi-destroying proteins. It creates this pro-inflammatory cytokine in the villi in the small intestine. The villi does most of our absorbing in the small intestine. They get damaged from when we start eating gluten. 98% of us. I'm not going to say all of us. And drip, year after year, decade after decade, and that's why we age before our time and we die before our time. We really should be living well past 100. Oh, but that's not possible. Telomere is this, and genetics that, history that. Right, now we're getting somewhere. If we got enough micronutrients on board, we would be living longer. And one of the reasons why that we have so much obesity, and it's only going to get worse no matter how many gyms, how many programs get put in place, we're going to get fatter and fatter because we don't understand. Yes, we don't understand. We don't want to subscribe to. We don't want to subscribe to the idea that we're not getting enough micronutrients, particularly chromium, vanadium, zinc, which is the whole obesity complex. They're only markers. Don't just go out and buy those three. You need to be supplementing with all the 90 plus essential micronutrients, right? Oh, this is about dentistry. It's about oral health. Okay, I sidetracked. Oral health, calcium deficiency issue. Okay, and we've even got whole glands complex designed at regulating calcium. And when your doctor says you have a raging calcium, you have excess calcium levels in your blood, that's more accurate, therefore don't eat any more calcium. Guess what happens then? Oh my goodness, guess what happens then? You go into even greater calcium deficiency because a spike in your blood levels, in your calcium levels, indicates raging calcium deficiency. The same sort of complex with, what's an example, esophagitis reflux. It's not too much acid, it's not enough acid. That's my next episode on this series, medical myths. Anyway, so you need to make sure that you are absorbing enough calcium, because if your teeth are falling out, orthodontia required, cavities, this and that, that's just oral complex wise. There's another 25 diseases which are all calcium and magnesium type deficiencies, but this is just about oral health. When your doctor says, oh, too much acid buildup, that's why we have the whole oral, gum disease. We've got the infants with the children with the cavities. We have the adolescents with the orthodontia. We got the middle age. We forgot the middle age, gum disease and gingivitis, and then we got the teeth falling out. Right? All that is not about oral health. Ooh, we can't be saying that. I am. I'm saying it. Some of us may have heard that brushing your teeth ruins the enamel on your teeth and that sort of thing, and yeah, it's more true. It's more true than the whole acid thing. It's more true than the whole brush your teeth more, floss more, clean your teeth more, check your teeth more, yada yada. Ooh, check your teeth more, right? So, eliminate gluten properly. Increase your calcium intake. Oh, but I'm lactose intolerant, right? No, 95% unlikely. That's another episode to do. The whole intolerance shite. Intolerance about gluten, yes. Dairy, no. No. So that's it in a nutshell. 85% by weight of all the 60 plus minerals that we need is calcium. We've even got a whole gland that regulates calcium. You need to increase calcium or have adequate. Even if you're having too much calcium, you can't have too much. You can't have too much. Basically, you're going to piddle the calcium out if you have too much. If you're taking one 200 milligram calcium tablet a day, I'm supplementing, I'm a vegan, I need calcium, I'm supplementing. And if you're still eating gluten, including oats, you're stuffed. You're not absorbing not even a tenth of that 200 milligrams. I think it's milligrams, it's not micrograms. grams? No, it won't be grams. Okay, milligrams. So basically, you need to be taking a whole bottle of that calcium supplement and not eat gluten to be absorbing the amount of calcium that you need. Because also, if your diet was right without the gluten, you're still not going to absorb that 200 milligrams of calcium, because that calcium is metallic based. Is a crushed rock based, depending on the brand that you use. Okay, the best absorbable form of all minerals for that matter, but also, which means calcium, is colloidal minerals, and calcium being as part of that. Okay, so that's that. I don't want to go too many minutes, because we don't like to listen to shit for too many minutes, right? That's it for today. Oral health, my ass. Oral health is about calcium absorption. That's all I got. That's all you're getting. If you can't grasp that, if that doesn't resonate, if that doesn't prick your ears, if that doesn't, maybe I should look. If you look into it more and you look up Google and calcium, it's going to say dairy free, get dairy free, all that sort of thing. I do wish you luck if you don't take my word for as gospel. I'm not the guru. I think I'm a guru. We all think we're gurus in our own health thing. Everyone's Thai place down the road is the best Thai place. My guy, my doctor's the best. We understand, right? So if this isn't resonating, bad luck. If you think I'm full of shit, bad luck. That's fine. I still have this history, this down in the gut history of thinking that I got this fairiness on my teeth. Let's brush your teeth. So I'm down to brushing once, maybe like a blue moon type occurrence, twice sometimes in a week. But let's say every 5 or 6 days I brush my teeth, just to get the furriness off. I've got other people doing what I'm doing. I don't floss, and my teeth, my gums have never looked so better. They're probably not the best from those people that had orthodontia and get teeth whitening. Yeah, I get it. But for me, with my 4 decades of history of brushing teeth and going to the doctor, mercury-based, those silver fillings and all that sort of thing, cleaning and gum, this and that, for the last 9 months, approaching a year, once or twice a week, that's all I'm brushing. And my teeth have not done so well in all my life. Just an anecdote. Let's see how you go in 5 years. Let's see how you go in 30 years. Yeah, let's see. But for that matter, let's see the whole health complex which I advocate on this space and the other spaces that I deliver my content to. Yes, it's gone too many minutes. I've lost many people. May not get many views, but I can't. In 30 years, I won't be able to say, I could have done better to help us, but here it is. I've done my bit, and if no one takes it, bad luck. I'll take it. Bye-bye for now.